The Thomas test is a good assessment for labral tears. What you do is you have the client sitting at the edge of the table, and I passively lower him down. He grabs his knee, the knee not to be tested in this case, and what I do is I stabilize his iliac crest so I kind of monitor for movement here. The big part of this test is though is when I lower his left leg, the leg I'm assessing, when I lower it down, a positive response is a click and or catch. And when I lower his leg passively down, if I'm getting a clicking and or catching, that would be a positive response with this test. So again, I start him up in the full hip flexion. I passively lower him down. A positive response is clicking and or catching was indicative of a labral tear, kind of an anterior hip position. A biomechanical explanation of what happens with Thomas tests, and so in this case what we're doing is we're testing the client's left side. So their right leg would be lifted all the way up with their thigh to their chest. So what you do with the client's left leg, the leg to be assessed, and left leg in this case, is you start them in flexion, and then you passively lower the leg down. So I would be stabilizing the iliac crest. I would passively lower the leg down. And again, a positive response would be a clicking or catching. And this time, instead of what happens with this test, is this time it's more likely to be a tensile load in this location where I'm pointing with my finger. So these people with labral tears are more likely to get the anterior tensile stress in this anterior position. What has been shown to be literature support for this is Lewis et al. Has shown that this location is the most commonly stressed location with hip extension. Additionally, some surgeons are finding that labral tears are happening in this anterior location, again most likely due to the passive lowering and stretch assessment, which will cause that clicking or catching with this Thomas test.